Hi folks, Dr. Marbali here. Welcome to Cancer Healing Vlogs. We're talking about what are the things you want to keep in mind if there is if you're getting a reading of high creatinine, that's like somewhere above 1.5 depending on the lab ranges. When that is happening, the first few things that you want to keep in mind is obviously you want to check your quality control if it's been done or not. That's something that you anyways do irrespective for any biochemistry test or any test for that matter in the lab. Additionally, you want to also see if there is a rerun that may be required. But before going for the rerun, you may also look at some things that may avoid that additional running of the test for no reason. How would you cross-check that? You can look at any other tests that have been done along with it. Like for example, if there is BUN, usually BUN is raised with the creatinine levels. There may be some other electrolytes like potassium that may be raised, or some disbalance in the calcium, phosphorus levels. Hemoglobin might be reduced. There's some correlating factors that may often go. Another thing that you can look at is you can of course discuss with the clinician that but even before that there is a previous findings of creat. So that's a simple thing. You just look at the previous in fact even before the other correlating parameters. If the previous creat was say in the same higher range or anything that is indicating towards renal failure, then okay, so previous was high, good chance that that kind of correlates. Clinical correlation is there. That's the main word, clinical correlation, with any test for that matter. And then of course you discussed with the clinician and see they said okay, it makes sense, the person has symptoms or they have a history of some renal dysfunction, and as long as those things are cleared, then you can go ahead and if even despite that there is some unsurety, or it's for the first time it's being found out, then you may even run a repeat test and just to confirm that okay, these are your findings and you've done your quality checks, and you may release the report after that. Just I thought some of the things that you may as a pathologist, you may as part of biochemistry, you may not come across that often while practicing in the lab, but then once you are actually starting your practice as a pathologist, it's going to be one of your daily things to be paying attention to. All right, say where, liberate self, like and subscribe. Cheers. See you.